my head to the side, bringing my ear towards the shoulder on the same side. I'm then going to take the free hand and add a light resistance by placing it on top of the outside of the head. From there, I want to strengthen this pattern by adding a little bit of resistance, but lifting the head and returning it back to the upright position. And at this position, I'm going to continue lifting the head, but I'm going to win by pulling it back with that hand, lightly resisting until I get into that lengthened position. Then I'll lift up with the head, strengthening that movement.
Sizes. And it's very simple. All you're really going to do is you're going to lie down and you're going to tuck your chin in. And as you keep your chin in, you want to try to lift your head up about an inch off the ground. Now, as you do this, you may start realizing your head's going to start shaking. You're not going to maybe feel a lot of stuff in the front. Another interesting thing is you want to do this exercise rotating your head. So you can rotate your head a little bit, keep that chin tucked in, and then lift your head up. Again, you're going to work a lot of the muscles in the front, bring your head back down and rest. So at the end of the day, this is probably the best.
Make sure their glutes are tight so you got them in good kinetic chain checkpoint alignment here. And then have them go into a forward head tilt. Like they're kind of pushing their chin towards the mirror. And then all you're going to do is cue a chin tuck and retraction, making sure you pay very careful attention to getting as much out of that retraction as you possibly can. Chances are if they have... So let me show you guys how that would work. If I thought most of her issue was in the lower cervical spine and I really wanted to work on the last few degrees of retraction, I might bring this down a little bit lower, giving her a little bit more tactile stimulation there, and then have her try to tuck. And this might be harder, it might be easier, it might just be different. It's definitely worth experimenting with. You can definitely get into a little bit of a mind trip, a little bit of a human movement science geek out, thinking what segmental resistance would do to the cervical spine. All right, and then I can go with the upper cervical segments if I thought that was where most of the problem lied. So let's say she has that atlanto-occipital or C1, C2 dysfunction, maybe C2, C3. Good, and she's retracting against that. The other thing that does is you guys can expand
the head. So you tuck your chin and you flex the neck. Okay, so I will show you from the side. Tuck the chin. And I'm maintaining a long neck position.
This is how they work, yeah. Good. As you do this, I want you to be mindful. Excellent. So you can start
Trapezius, the upper trapezius. So let me show you how to do it. So you will first flex the head to approximately 45 degrees. Okay, you will flex the head somewhat forward. Now you will rotate it ipsilaterally to the same side, again approximately 45 degrees. Now I want to be somewhat vertical in my thorax. I do not want to lean very much back or forward. I'm quite vertical. And now forward, rotate, and then I will translate my head towards the ceiling slightly anteriorly. So there's a slight oblique angle there. Now you can palpate the clavicular portion of the SCM while you're doing this motion to ensure that you are in fact stimulating the muscle and that it is contracting throughout the whole motion. If it is not, try to reset the alignment as I told you and try again. Okay, forward, rotate, and now moving upwards. And on the first rep there, I was moving too much with my forehead. It's not correct. I should guide, if you will, with my mastoid process. Okay, there. And I can feel it contract.
right here, which is a huge muscle. So if you think of just pulling a Jim Carrey, like kind of jutting out your chin, yeah, right, and you can smile, yeah, and you'll feel like a nice constriction happening here, and then just let it go. This is one of my favorites. It's called Kiss the Ceiling. One of my favorites is called Kiss the Ceiling, and literally you just stick your chin up and really try to plaster a wet one up on the ceiling. Mwah. Mwah. Tip of the tongue to the roof of the mouth, smile and swallow. And you're going to do it at several different angles. So first I'll do it to the right. I'm going to tip my chin up, tip of the tongue to the roof of the mouth, smile and swallow. Right, and you can really feel those chin and neck muscles working. And then you do it to the other direction. Tip of the tongue, roof of the mouth, smile and swallow.
Do you do these as a series?
Traditional to slide the lower teeth over the upper teeth. So it's a similar action, working again the neckline and the chin.
And it's probably important to keep the rest of your face relaxed.
As always with everything.
Then you're going to just tuck your chin straight back. You're going to hold for 20 to 30 seconds and then relax and repeat 2 to 3 times. The next one, you're going to tilt your head to one side, tilt it to the left to start, and then next you're going to rotate your chin up to the right towards the ceiling until you feel a stretch in the sternocleidomastoid muscle. Hold it for 20 to 30 seconds, putting a mat or something soft against the wall. Put your head against the wall, keep your feet about 6 to 12 inches away from the wall. Legs straight, and you're going to brace yourself with just your head against the wall and lean at an angle to where the tension is in your neck. You're going to hold for 20 to 30 seconds at a time. Plank, and you'll do the same thing except you're going to roll onto the forehead and you're going to tilt the chin down and you're going to tilt it up. When you tilt it down is when you're going into flexion, so that's when you want to hold it for 20 to 30 seconds.
And what you want to do is turn your head about 45 degrees to the opposite side that you want to stretch, and then use that same arm to get onto the crown of your head and try to pull or guide your nose down into your armpit. And you should feel a nice comfortable stretch right in the neck.
Be stretched down and back, a slight external rotation of the hand, and then with no rotating from the head, I'm going to ask her to slowly start to drop that left ear towards the left shoulder. You'll take to the first point of tension, you'll feel the tension here on this side, and hold for 30 seconds.
Ear, and then turn your head slightly to the right for the first position, and then drag it across the table, and you'll feel a stretch in the posterior scalene. Then come back to neutral. The next one is the head straight forward. You'll tilt it over again to the same side. The stretch will be for the middle scalene, holding it for 10 seconds. And the last one, which is frequently the most important, you tilt your head to the opposite side, and the stretch will be in the anterior scalene, holding it for 10 seconds.
Hook your fingers above your collarbone and gently side bend your neck to the opposite side. Hold the stretch. You can make the stretch stronger by extending your neck. You should feel the stretch at the front in the webbing of your neck, just above the collarbone, and rotate your neck to the opposite side and tuck your chin down. You will feel a stretch under your fingers at the side.
We're nowhere near any trouble area. And all I'm going to do is going to pull straight down and in, just a little bit of pressure. You don't need very much at all. I'm going to shorten the muscles by looking and tilting to the right. I'm going to lock in on those muscles and then simply slowly look the other direction to the left. So while I'm doing that, the pressure with my two... I'm finding the clavicle, the collarbone. I'm going to take, again, my 2 finger pads softly into that soft spot right there. Draw tension down and in as I look to the left. Now, if you're doing this properly, you should feel it tighten as you get to the
Chin forward and tilting your head slightly upwards, place the tips of both thumbs under your chin. Next, place the tip of your tongue against the roof of your mouth, gradually increasing the pressure of your tongue, while holding your thumbs firmly against the muscle. This exercise stretches.
Leaning away from it a little bit to anchor the shoulder down, turning your head towards the same shoulder, extending your neck, and with other hand you are grabbing your head above the eye and pulling your head towards the opposite shoulder and a little bit back, like this. And at the same time trying to rotate your head as far towards the side you're stretching as possible. Hold your
flex here, rotate away from the side, and flex forward. And the dots get quite close together. So really great way to stay as close together as possible. We just apply a little bit of pressure here with the fingers, in and down towards the origin, and then we separate the dots.
Right under your collarbones on both sides, I want you to look down and I want you to push into that depression under the collarbones. And then I just want you to smile and look up and feel. Notice that pull, that
hold this area, go almost down to the clavicle. And you will feel that muscle tighten. We're using this to treat the myo.
And then to make this active, I'm going to have her move the ball just superior to the trigger point. Not really off the trigger point, just to the top of the adhesive area. And then I'm going to have her go through all of her neck motions that would elongate her levator scapula. So it's going to be contralateral flexion, contralateral rotation, and a little bit of flexion as if she's looking into her opposite front pocket. Good. And then go ahead back to neutral. And then back down into a stretch. Front pocket. Reach up. Good. Down. Into that last.
Just above the collarbone, behind the sternocleidomastoid, that big long muscle on the side of the neck, you'll find this deep scalenes. And they'll be pretty tender, so go in there pretty easily. Obviously, if any of this hurts, don't do it. Or stretch right below the base of the occiput, the skull. You'll find a little soft spot. Those are often tender. These are the suboccipital muscles. We're targeting just the kind of the top two, and they stretch during tucking of the chin. So here I'm really forcefully tucking the chin as I use my thumbs to sort of just massage in that area a little bit.
All the way to the opposite side, going ear to shoulder. Show another rep here, tension, side bend through. Want to get that.
You don't want to be massaging arteries or veins. That can cause other problems that you really don't want to get into. So for the last scaling, this one's a little bit more interesting. It's, like I said, it runs down from the neck down to your rib along the trap. So you're actually going to find this little triangle right here where your trap and your collarbone meet. You're going to shove your fingers down into this gap and you'll feel a little muscle again, probably about the width, maybe the width of your pinky, and you're going to feel a hard surface down there, which is your first rib. You're going to push into that triangle and slide across, pinching that muscle between your rib and your fingers. A good way to do this one is to cross your fingers over like this to get a little extra support so you're not beating up just one finger. And again,
if we feel we're on the longus colli, we ask the client to lift her head and neck into flexion, which will engage the longus colli, and we can strum perpendicularly across it. We then continue to explore and palpate the longus colli inferiorly and superiorly as she contracts and relaxes the muscle.
To the area where the muscle tissue, fascia and nerve endings are slightly congested, and apply gentle pressure into the neck. You can also do movements of the arm in order to break down some of those adhesions.
Skin rolling, where you can actually take the skin over this area, find this is the mastoid, find that muscle, and just kind of pull on it. And you know, you can do this in the privacy of your own home, in your bed, just kind of grab it, and you're just hold a little pressure and make circles. In this area, you do want to be a little careful because underneath here, we do have a very important thing called the carotid artery. So if you start to get dizzy, lightheaded, you're pushing way too hard. If you're having pain in these areas, it's sports.
So I'm going to pin and downwardly rotate the tissue, and then I'm going to mobilize the neck by flexing away, laterally flexing away, rotating, say yes, say no, and then we're going to open and close the jaw. And then come back up and repeat on the other side.
The sternocleidomastoid.
And the sternocleidomastoid. Another
C.
Hi, my name is James Grafenberg.
Massage therapist. This is my friend Vanessa.
Hello.